What are best cleaning practices for healthcare? For all environmental cleaning procedures, follow the rules of your employer. Some general principles include: first, make a visual assessment to determine if the patient's, resident's, client's, or consumer's status could pose a challenge to safe cleaning. Determine if you need any additional PPE or supplies. For example, if there are any spills of blood or body fluids, or if the person is on transmission-based precautions. Carefully follow directions and precautions on all cleaning products. Proceed from cleaner to dirtier areas. Clean from high to low, top to bottom, to prevent dirt and microorganisms from dripping or falling down and contaminating already cleaned areas. Clean spills of blood or body fluids immediately. When you wipe surfaces, use mechanical action, rubbing, scrubbing, and friction, and make sure that surfaces are thoroughly wetted to allow required contact time for disinfection. Let disinfectant stand for the required time, following product directions. Wipe surface with a paper towel that can be thrown away or a cloth that will be washed immediately afterward. It's very important to clean and disinfect high-touch surfaces, those that receive frequent hand contact. Common high-touch surfaces in hospitals, nursing homes, and individual clients' or consumers' homes include doorknobs, over-bed tables, bed rails, ivy poles, toilet and sink handles, bedside tables, counters where medications and supplies are prepared, edges of privacy curtains, monitoring equipment, transport equipment including wheelchair handles, call bells, telephones, remote controls, and light switches. Always wash your hands after cleaning or disinfecting, even if you wore gloves. What is COVID-19? What does it mean for healthcare delivery? What does it mean for you as a healthcare worker? How do I protect myself and others? Wash your hands using proper hand washing technique, 20 seconds. Soap and water can kill the virus. If soap and water are not available, use hand sanitizer with at least 60% ethanol alcohol or at least 70% isopropanol alcohol. If you are in close contact with a patient, resident, client, or consumer who has or is suspected of having COVID-19, follow correct procedures for wearing personal protective equipment called PPE. PPE consists of gloves, a gown, mask or respirator, and goggles or face shield. A gown should fully cover your torso from neck to knees and your arms to the end of your wrists. It should also wrap around the back. Fasten it in the back of your neck and your waist. For a mask or respirator, secure the ties or elastic bands at the middle of your head and neck. Fit the flexible band, if present, to your nose bridge. Fit it snug to your face and below your chin. Seal check a respirator each time. Place goggles or face shield over your face and eyes and adjust to fit. Before putting gloves on, remove all sharp jewelry and wash your hands. Put your fingers into the tips of the glove, then pull the entire glove over your clean hand. Extend the gloves to cover the wrist of the gown. When removing personal protective equipment, do it carefully and be sure to follow correct procedures, or you may risk exposing yourself or others to the virus. Remember that the outside of both the gown and gloves may now be contaminated. Your gown and gloves can be removed separately or together. To remove both gown and gloves together, grasp the gown in front only with gloved hands and pull away from your body so that the ties come apart. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Then place the gown and gloves into a waste container. Remove goggles or face shield from the back by lifting the headband without touching the front of the goggles or face shield. If the goggles or face shield are reusable, place them in the designated receptacle. Otherwise, discard them in a waste container. To remove a mask or respirator, grasp the bottom ties or elastic bands, then grasp the top ones and remove the mask or respirator without touching the front. Discard in a waste container. Finish by washing your hands with soap and water, or use an alcohol-based hand sanitizer immediately after removing all PPE. Remember to perform hand hygiene between steps if hands become contaminated and immediately after removing all PPE. We also urge healthcare workers to take additional steps to ensure their safety and the safety of their families at home. This includes removing uniforms at the end of shift and before interacting with family members. Some experts also recommend that healthcare workers shower upon returning home before engaging with children, elderly, and all family and friends.